Hi, everyone. We'll give everyone a couple minutes to join in. We have a lot of people signed up tonight, so I think that it will take a couple of minutes for them to get onto the webinar and to get settled.
How's the connection? It sounds pretty good and it looks fairly bright.
Yeah, it
Okay,
looks fine.
Yeah,
good.
it
All right,
is.
great. And I have my ear pods. I can hear fairly well as well.
Oh, good,
All
good,
right.
good.
I'm very sorry about this. It's not, it's supposed to be, oh, it's my computer that's doing that.
Ringing?
Somebody is trying to reach me.
Mm.
I
Okay.
got a message from Janie,
Oh,
that
Janae?
Janae, who said that you were having trouble
Oh,
getting on.
well, that was before 6 o'clock.
Okay.
I'm good now. Yeah.
All right.
All right. So our audience is filling up.
Good.
So hi, everyone. We're so glad that you can be here tonight at this town hall. As you know, we have two candidates for the PA-03 congressional district who we're going to talk to tonight. So, just a couple of pointers. They are going to each give an opening statement, and then we will ask some questions. Those questions were submitted by you all, and so we're going to ask them, the ones that we can get to. And you can also put questions in the chat. No guarantee that we will get to them, however. But go ahead and put them in the chat, and if we can, we will ask those as well. Our two guests are Dr. Alice Stanford and Dr. David Oxman. They're both obviously doctors, so similar backgrounds-ish. And we thought that that would be worthwhile for tonight. So with that, it says a lot of echo. I'm sorry. I don't know why that's happening, but I will not be speaking after this, basically. Um, so, with that, I will let Meg take it away, and Meg will ask the questions.
Uh, okay, I'm trying to put in my ears so that you don't have an echo. So if you just bear with me, I'm sorry, I didn't realize I needed to do that, but um, sorry. Bear with me. I'm sorry about this. Okay. All right. Here we go. All right. Can you hear me? Everybody can hear me? Excellent. Okay, good. Thank you very much. Well, so welcome everybody. We're glad you could all join us. So for tonight, the way we're going to do it is that each candidate will have 2 minutes for an opening statement. After their opening statements, we have given them questions to ponder so that they could give us their best answers to two questions. They will have 3 minutes each to answer them. After that's over, then we will have questions from you all, which we have noted and we're prepared to ask them. And then they will have, when we get closer to 10 minutes to 7, we'll have um, um, a closing statement from each candidate. So we're very happy that you're here, and let's get started. So, Dr. Oxman, would you like to start with an opening statement?
Thank you very much, Meg. It's a pleasure to be here. And, I have to say, Indivisible is a group that's very close to my heart. It got me through the first Trump administration. So, in 2 minutes, what can I tell you about myself? Well, the first thing I want you to know is I'm a native Philadelphian. My roots go back 4 generations in this town. I'm an ICU doctor and a medical professor. I also teach medical ethics. In addition to working with patients, I work in patient safety and hospital systems. My work has taken me around the globe to Africa and Central America. I also write frequently and for a while was a regular contributor to The Hill on issues related to medicine and science. And my worldview and my political sensibilities are very much shaped by my work. I see so many of the challenges Philadelphians face literally written into the bodies of my patients. And for most of my career, my political activities, I guess would say, were very much in the doctor lane, whether it's working on gun violence or addiction or our health insurance system. But now I'm broadening that and people ask me why I'm running, and they think it's just because of the medical issues involved that are going on in this country, the Medicaid cuts and et cetera. But really, what I want you to know is I am stepping out as a Democrat. 2024 revealed so many deep issues with our party. Too many Americans are seeing the Democratic Party as one that is content in tinkering around the edges of very big problems. And for many others, we're seen as a party that is very expert at calling people out, but not so good at calling people in. And I think while it's hard to take our eyes off the daily train wreck that is the Trump administration, Democrats really need to search for a realignment. We need to start building the big coalitions together to do the big things. And I don't see enough leaders in the party willing or able to help chart that different course.
Okay, thank you. Dr. Stanford.
Yes. Greetings, everyone. I would say nice to see you all, but I can't see you. I saw some of you at the No Kings rally. It was great to be there. I am a proud daughter of Philadelphia. I was born at Broughton Olney to a teenage mother. I was raised at 18th and Erie on SNAP benefits and SEPTA and Section 8 housing in our public schools. As a child, I stood in line for food, unemployment, city clinics, with people deciding what my brother and I would never become. But this city had my back, from my mother and grandmother to teachers, neighbors, and mentors who pushed me to dream bigger. A former Philadelphia congressman awarded me my first scholarship because I was poor enough and smart enough, and it opened the door to college, medical school, and to become the first Black woman pediatric surgeon trained entirely in the United States. And after all of that, I came home because Philadelphia made me, and I knew where I was called to serve. When COVID hit and government failed to meet the moment, I did not wait. I founded the Black Doctors Consortium. I put my own resources on the line, and together we tested and vaccinated more than 100,000 people. And that work didn't stop when the crisis faded. Today, I run a health center at 21st and Lehigh and a second location on State Road where I see every day what families are facing. People choosing between medicine, groceries, parents rationing care, and seniors delaying treatment. And that's why I'm running for Congress, because I don't just talk about the problems, I've spent my life solving them. I'm ready to fight to lower everyday costs, to expand access to care, and to bring real investment back to communities that have been overlooked for far too long. This district is my home, and I've proven what I can deliver. And now I'm ready to fight for Philadelphia in Congress. Thank you.
Well, thank you, Dr. Stanford.
Thank you.
Okay, so the next question is, how well do you work with others? Please give at least one example of how you collaborated with others. So Dr. Stanford, would you go first, please?
Sure. So service is my default. And as a surgeon, we are used to being detail oriented and solving complex problems to which there are no solutions. I'm going to try to give you three examples. One, during COVID, the SEPTA bus drivers, the rail workers, they were dropping like flies because at the time we didn't really have recommendations and people were still getting on the bus. It was wintertime and the doors were closed. I was fortunate that Senator Art Haywood listened when I reached out for help, and also Congressman Dwight Evans. And I said, I want to help. What can we do? And they were able to put me in touch with the leadership at SEPTA. We had something that could help. And so we put a testing site from Fern Rock Station all the way to 69th Street and Suburban Station and everywhere in the middle. And what that allowed the drivers to do when they got on and off the bus was to get tested. And when vaccinations became available, we also offered it for them. We came back and also for their families. Now, I was appointed by President Biden in a federal leadership role after being recommended by State Senator or by Senator Casey, Bob Casey. And at the time, there was a shortage, an infant formula shortage. As a federal official, I couldn't just say, drink milk if you're 11 months old. I had to work within the bureaucracy. So when I took off my federal hat, I went to all of my network and said, get all of the formula you can off the shelves. Then I went to the community and social media and said, can you post this? And I went to a nonprofit in a church parking lot, face to camera, and said, if you need formula, we have it here. And people came and we were able to feed children because moms were and parents were mixing water with the formula just so it was white enough. But when you drink too much water as a baby, it causes swelling of the brain. And that was also, and I think I have time in 20
No,
seconds. No, I don't. Oh, that was
no,
my
you don't.
two.
That
That
was
was
your
my
two.
two.
That was your 2 minutes,
Okay.
but
Darn
I'm
it.
sure you'll find time to say it somewhere
Okay.
else. All
Okay.
right,
Thank you.
Dr. Oxman.
So,
I'm sorry, you're frozen.
hello?
Dr. Oxman.
Yep.
Oh,
Okay.
there you are.
Two,
You're back.
two,
You were frozen.
I'm sorry. Was it 2 or 3 minutes? I'm sorry. I just want to.
It's
I
two
thought it
minutes
was,
for, it's two,
oh,
let me check. All right. You know what? Let's just go with three.
oh,
Dr.
so
Okay.
I can
Stanford,
do
go
my
Let's
ahead.
final
not,
three.
Yeah, go
Thank,
ahead, Dr.
let
good
Dr.
Stanford.
looking out,
Stanford.
Dave. Okay,
Okay.
and so my final story as regional director, so I'm in this federal role, and Mpox comes out sort of after COVID. And the vaccine and the test were going from the federal, from DC to the state. And it was bypassing Philadelphia. And we had to wait. And so with the health commissioner, Dr. Betigol, she reached out. She said, we've got folks that need tests and people that need the vaccine. And so, in my role in overseeing the CDC, I was able to say all of the cases are in Philadelphia. But once I was able to get the vaccine to Philadelphia and the testing, I had to get it to the community. So I dragged my husband. We went to a club one night that was LGBTQ plus. We had square cards with a QR code on the back. And when people paid their entry fee, they could get a card for more information. That Monday at my health center, we had over 100 people to get vaccinated and get tested. And they were unable to do that in the health department. Okay. That was
Thank
my
you.
third.
All
Yes.
righty. All right, Dr. Oxman, go ahead.
Well, you asked two doctors to speak tonight, so you're going to get two doctors' stories, and some of it's going to overlap with COVID.
Sure.
So what I do as an intensive care doctor, what I say about intensive care medicine is the ultimate team sport. No lives are, I've never saved a single life by myself. I've done it with a team of highly trained medical professionals, from nurses to respiratory therapists to pharmacists, et cetera. And every one of those teams wants the best. But sometimes leading those teams can be challenging, and there's disagreement. And I've learned a lot from my job about collaboration and leadership from this work. When you want to build a team, it is so vital that everyone in that team feels not only listened to, but respected. Because when you have created that culture of respect during the tough times, you can lean into that culture. And during the spring and summer of 2020, when my intensive care unit was literally bursting at the seams, and my team did not know how we were going to get through another day, we very much leaned into that culture because we had built that culture where everyone felt respected over years and years. You can't fake that. I think the other part of collaboration that I do as an ICU doctor, a lot of my patients I can't speak with because they're so sick, but I spend so much time speaking with their families. And, I'd like to say that I meet people on the worst days of their lives, days when they literally do not know what's coming next. And shepherding people through that illness and that chaos of those moments is incredibly rewarding to me. I've also encountered a lot of distrust in the medical profession. I walk into certain rooms and I represent an institution that has failed so many people or has given them good reasons not to trust them. And I've learned a lot about how to earn people's trust. And it's not that simple in theory. I mean, excuse me, it is simple in theory. It's basically being honest, even when it's very difficult, and being fully transparent. And I think the other thing is not being afraid to show a little bit of your own humanity. And I'm very proud of the trust that I have built with families of critically ill patients over the years. And I think it has taught me a lot. I think if communicating in those situations is not good practice for politics, I really don't know what is.
Okay, thank you very much. I have a follow-up question for Dr. Stanford. I just want a little clarification. You talked about not getting funding, I think, for every place in Philadelphia, but every place in Pennsylvania, but Philadelphia. Is that what you said?
Were you talking specifically about MPOX? I'm not sure which
You
question
had
someone was
mentioned,
asking.
yeah, you had just mentioned that you were active in getting um the
For monkeypox,
for
for MPOX?
no for COVID. I thought that's what
Okay,
you were talking about.
well, I'm not sure which question because there were two. I'm not sure the question you're asking about which instance,
Was it
about
was
instrumental in getting funding for,
yes. I thought it was COVID, but it could have been Mpox.
well, oh, it was MPOX. Okay.
Okay.
So as a federal, now this is in my federal role, leadership role, HHS regional director covering Delaware, DC, Maryland, Virginia, West Virginia in the Commonwealth of PA. The way the vaccine came down is it went from the CDC to the state. And so, being at the state level, what the federal government didn't know is that it didn't help to send it to Harrisburg when the majority of the cases were in Philadelphia. So, when Philadelphia Department of Public Health, the health commissioner, Dr. Bettigal, reached out to the
I
federal
see.
level, she reached out to me. So, this is the
I see. Okay.
intergovernmental. And then I was able to facilitate it getting directly to Philadelphia. And then with my grassroots organization and the health
Great.
center I built, we were able to provide a place for them to get the testing. But it also required me going to the people literally where they
Sure.
were. And that
Yeah.
was where that came in.
My
Yes.
question was whether it was a state or a federal decision. So you've
Well,
answered that question. You've answered
okay,
that question.
fantastic.
Yeah.
That was the collaboration of working
Right.
together.
Right.
Understood.
So,
Yes.
okay. So, Dr. Oxman, the next question is for
Mhm,
you. This is from our audience. What
mhm.
is your position on healthcare, universal, Medicare for all, the way we have it now?
Yeah. Well, I like to say that Americans are in an abusive relationship with their healthcare. Everyone knows that they need to get out of the relationship, but we are afraid to leave because we think there might be something worse down the pike. Right now, we have a health insurance system where the private health insurance system makes about $70 billion a year in profit, and even Americans with health insurance still worry that if they had to access that health insurance, they might be one illness from a GoFundMe page. So the thing is, we do not have to have health insurance like this. I was a supporter of the ACA, but really the ACA is about giving private subsidies for Americans to buy government subsidies for Americans to buy private insurance. We need to go way beyond that. And that's why my whole career have been a supporter of Medicare for all. And what I've said and I've written about many times is this is not only an issue about our health, this is an issue of our economy. There are so many perverse incentives in the current system that drive up the cost of care, right? And I think that's something few Americans know about. So much gaming of the system from my very own healthcare system that increase the cost because of the systems that we have. Um, and the other thing about Medicare for All is for a long time, Democrats or Democratic leadership had thought that a Medicare for All plan was a kind of political kryptonite. I believe that times have changed substantially, and it's actually a political goal. I believe that if the Democrats really start leading with Medicare for all, it's not only the right thing to do, but it's a political winner. And we're going to bring people from both sides of the aisle with us.
Thank you. Dr. Stanford.
So I too agree with universal health care and Medicare for all, so much so I built it. And you can see it anytime you want at 21st and Lehigh. It was one of the triumphs over tragedy with COVID, because when all the health systems were turning away people that were underserved and underinsured or uninsured, or their doc wasn't on staff, or whatever reason was given, when the CARES Act was passed, which was a federal legislation, I was able to submit claims as a private business owner for all the people that everyone else had turned away. And I took that money that I earned and I reinvested it and built that health center in one of the lowest life expectancy communities in Philadelphia. And we've since opened a second location on State Road for the unhoused with mental health and substance abuse challenges. But this is what we do. If you have insurance, we take it. If you don't have insurance, we still see you. There is no tiered care, which is what exists, unfortunately, in our healthcare system. I recently had at one of my other facilities say to me that a person sat in the ER for over 2 days because there was, quote, no Medicaid bed available. That is a problem. And I agree with Dr. Oxman, the monopoly and the lack of accountability with healthcare is unacceptable. The fact that CVS owns Aetna, they own CVS Caremark, they negotiate their own rates for medication, and they own Oak Street Health, which people thought, wow, these are coming into poor communities. But what happens is they see their doctor at Oak Street Health and CVS gets paid. They send them to CVS for the medication and CVS gets paid. They use Aetna and CVS gets paid. And then because they're part of the marketplace, the patient is paying a small portion, but then they're getting this larger sum from the federal government. And they're earning trillions of dollars and people are not living longer. And so it takes someone who understands the system of delivering care and the business of medicine to really revise the Affordable Care Act.
Thank you. Dr. Stanford, the next question is for you first. What do you plan to do to make sure PA kids have access to what used to be the routine childhood vaccine schedule?
Is that for me?
Mhm.
Oh, man. Okay. So, as a pediatric surgeon, you obviously have to work with, I apologize. Of course, someone is calling me multiple times. Um, Forgive me. You have to work with the state. Goodness gracious. Hello? Okay. You have to work with the state and also have a relationship with the school district of Philadelphia. This is something that has to be at the federal level, at the state level, and at the city level. What I've been able to do is use my platform to reinforce for folks that even though the Secretary of Health is not saying you should get vaccinated, that we now have an outbreak in South Carolina with over 1,000 cases when we haven't seen measles for decades. And ultimately, the Secretary of Health, Kennedy, is causing people to be sicker and some to lose their life. And so, what that means is that as a trusted messenger, not just as a congresswoman, to say, as a mother, as a pediatric subspecialist, these are the vaccines that you should have to protect your family and your children, and especially those who are immunocompromised. And it means it has to be going into communities, it has to be public service announcements, and reminding folks the people making these rules have all been vaccinated. Their grandchildren and their families have all been vaccinated, but they're telling you you don't need it. And those who are most impacted are those who need a safety net and the underserved. And so, what that means is dissemination, information in different languages, using yourself as an example, and debunking the lack of evidence that currently exists with the recommendations being made and showing people what's happening, which is just sad to see in South Carolina and Texas and Florida.
Thank you. Dr. Oxman.
Could you just repeat the question again? I want
Sure.
to get
What do
all
you
the
plan
aspects of.
what do you plan to do to make sure Pennsylvania kids have access to what used to be the routine childhood vaccine schedule?
Well, I would start with getting rid of our walking, talking a threat to public health that is our HHS director. And if I can't do that, I will do everything I can to shine a light on the lunacy that he is spreading. My wife works in vaccine research, and I had to listen to the ACIP meeting where these people were going over this handpicked panel of quote unquote specialists. The As bad as it seems from the outside, I am telling you right now, it is worse on the inside. He's taking a sledgehammer to public health. He's taking a sledgehammer to vaccines. And sadly, the thing that he is going after right now, which it's not even just about changing childhood vaccination schedules. He's creating a climate that is dampening research into vaccines and dampening production of vaccines because companies don't want to take risks when they don't know what the market's going to be. And then the holy grail for RFK Jr. is he's going to challenge the no-fault system for making claims for people who've been injured by vaccines. If that were to go, we are going to be in a very dark place. So I think right now, what some states are doing, I think including Pennsylvania, is creating their own advisory boards. Because the sad thing is, we can no longer trust the recommendations coming out of the CDC. That is a very scary thing to say, but it is true. So I think for Pennsylvania, thankfully, we have a Democratic governor and where sanity reigns. And we're going to have to create the infrastructure locally statewide that we used to rely on the federal government for, because right now they are not, they are not giving us reliable advice. And I think that also means we have to support local municipalities as well. One of the things that's going to happen with the vaccines is certain vaccines that are no longer recommended will no longer be covered by insurance. And that's going to hurt kids from lower income backgrounds the hardest. And we have to hit that cover that slack.
Okay, thank you. Next question. Dr. Oxman, you get to go first this time.
Mhm.
My greatest concerns are protecting the environment and mitigating climate change. What can
Mhm.
you do to accomplish these goals while representing Pennsylvania, which seems committed to promoting fracking, fossil fuels, and data centers?
Yeah. Well, I think it's sad. The climate issues have almost gotten lost in the daily chaos and dumpster fire that is the Trump administration right now, right? The fact is, he is not just whittling away, he is unleashing unrestrained fuel exploration. He's stopping all regulation around the EPA enforcing limits on greenhouse gases, and he's undoing so much of the work that the Biden administration undertook. I think the positive side is that so much of the work about creating sustainability is happening anyway. It's happening at local, it's happening at state levels. Obviously, not having a federal partner is horrible, but I would continue to support investment in sustainable energies, continue tax credits for people who are able to invest in sustainable energies, and obviously, rejoin the climate accords internationally and become a partner, not just a partner again, but a leader. And as far as the question of fracking goes, I'm against fracking. Not only is it uh, continued dependence on fossil fuels, but it also uh, is horrible for our environment and our safety.
Thank you. Dr. Stanford, do you want me to repeat the question?
I think I'm okay.
Okay.
So specifically as a congresswoman, what I'll do, and I'll start with what I'll do and then how it's impacted me thus far, is it's a clean energy investment. And it's not just about funds into the community, but it will allow for creating jobs. It'll bring down energy costs with solar, for example. It makes communities safer and healthier. And it has to prioritize poor and working communities. And, in the class I teach at the University of Pennsylvania to undergrads, we recently have been talking a lot about these data centers and the fact that they're being bought up in poor communities where people typically don't invest, but they just need a large enough area, which unfortunately there are lots of them in Philadelphia and other places. And the more we use AI and the more that we're on our computers and you need the water to cool down these super hot data centers. And now they're adding coolant to them. And then that all has to have some place to be disposed, which is I'm seeing it now in the Schuylkill River. Right. And so, what it takes for one is bringing in the experts on preserving our environment to guide us and the engineers and reinvigorating the EPA to say, how can we still have access to this technology, but not doing it on the backs of those who are already struggling to get by? Um, I recently had to comfort a child whose friend died from an asthma attack. I mean, Philadelphia has the fourth worst air quality in the United States, and no one should be dying from asthma. But when they don't have the resources, which goes back to affordability and being able to have an inhaler in your backpack, in your desk, in your locker, anytime you might have an acute attack, this is what we're getting, which is why at my health center, you will see green grass, you will see flowers, you will see trees, you will see fish tanks, because typically you don't see that in underserved communities. And I'm trying to lead by example. So I will support the clean energy investment. Of course, I'm against fracking, and it's about creating jobs and bringing down energy costs and keeping our communities safer and healthier.
Yeah. Okay. Um, Dr. Stanford, this one's for you.
Okay.
It's likely that the Democrats will dominate the House after the midterms. If so,
Oh,
how will you,
from your lips to God's ears.
yeah, if so, how will you go about holding the administration and its departments accountable for their illegal actions? It's a big but important job, and it needs careful thought. How will you work with others, and how will you prioritize the best outcome?
Thank you. That is an excellent question. I say this to my teenage sons. There are three branches of government. However, the only one that we hear from all the time is the executive branch. Our legislative branch has been almost silent. Our judicial branch, I'm not sure where they are, but they are the ones collectively that we can identify all of the unconstitutional acts that exist. Even the SAVE Act, we discussed this in class today, talking about how even a woman whose maiden name is different from their married name might preclude them from being able to register to vote. Someone who can't afford a $40 ID card or driver's license or have access to their birth certificate, not being able to vote and find what is illegal in what he's doing. The fact that and prioritizing. So one is obviously voter suppression, so that when we get to the presidential election, this is addressed. The other, the fact that we have Supreme Court justices that are named in the Epstein files is unacceptable. And other people in his administration, we need to to hold the Attorney General accountable and prosecute these people to the full extent of the law. We also have to make sure that 47 can't incite any more wars. Like, taking the Venezuelan president and his wife and claiming that it has everything to do with restoring order, where all I see is continued oil rigs being snatched up every opportunity that you get. And so what I'm saying, and I could run down a list of items, is that when the legislative branch, when we recognize that we have more things in common than we have apart, no one is supporting this immigration and ICE. No one is supporting that. No one wants to see Americans killed in the street and children being ripped from their families. And when we can identify where we stand aligned, that's why we are stronger as a unit. And I believe the judicial and the legislative branch, as you said, flip to blue, working together, will be able to enforce the illegal and unconstitutional acts that 47 has been able to get away with this long. They've been silent too long. New blood coming in, we will elevate our voices.
Thank you. Okay, Dr. Oxman.
Look, when the Democrats take control of the House again, as I think they will in 2027, there is going to be so much to do, so much wreckage to look into, so much criminality to uncover. Where does one start? Obviously, I don't think the Democrats are going to have any hesitation about reclaiming their Article 1 duties, right? The reason the Republicans don't is because they really have no interest in doing anything independent. So some of my priorities. Well, I mean, one, we need a truth and reconciliation style committee into these first 2 years of the Trump administration. One area particularly is the blatant corruption that this administration is just engaging in. Um, None of that is coming to light while the Republicans control the House. Second is the undue influence on media that we see in the United States. That needs to be looked into, and we need to exercise oversight. Obviously, what's happening with ICE? Frankly, when I look at ICE, I see an institution that is so beyond rehabilitation. I'm not sure exactly how it can be anything but abolished and recreated anew. But we have to have investigations into what's happening with ICE. So much of what's happening is really not coming to light. So I think,
Oh dear.
as far as asserting oversight authority when we come back into power.
Okay, thank you. Interesting question. How will you be different from our current set of do-nothing Democrats who talk the talk, but apparently no longer how to walk the walk? I don't want just words, but actions, House votes, bills, etc. on the following, please. So Dr.
Yes.
Oxman,
Yes.
it's Dr.
Oh,
Oxman's turn. Sorry.
okay. No, it's okay.
So one of the things you do as a congressional candidate is you talk to a lot of people, and particularly you're running on a primary, you talk to a lot of Democrats. And I can tell you, Democrats disagree on many different things, but one thing they are 100% unanimous on is that we can't continue this way. The discontent with the Democratic Party is nearly universal. Now, there's some disagreement on some of the solutions, but people feel completely let down by their leadership. In some ways, I feel a little bit sympathetic to the idea that look, we don't have a lot of legislative options as Democrats, right? But Democrats have to realize that the power that we have as a party does not just lie in how many seats we have in Congress, whether we have 51 seats in the Senate or 49. It's about how we rally the rest of civil society to our side. The levers of power in this country do not just reside in Washington. They are scattered throughout civil society. They're in our unions, they're in our medical centers, they're in our law firms. And one of the things, amongst many, that Democrats need to start doing is communicating a message to tell to the seriousness of the moment we are in and start bringing people to our side. Because again, it's not just about how many seats you have in Congress, but it's about how you rally society to your side. So that would be one of my uh, big priorities, communicating that.
Okay, thank you. Now, Dr. Stanford.
So you can hear me. I keep going
Yes.
on and off mute. Okay. So I think it's twofold. On one hand, of course, we've got to pass Obamacare reform. We've got to claw back that big, beautiful, ugly bill and the John Lewis Voting Right Advancement Act we need to push. So that's the legislative side. But at the same time, as a congresswoman, we have funds allocated to our communities. And that's when you have to be in touch with what's happening on the ground throughout the district. Because the funds that come forth, Congressman Brendan Boyle, Congressman Mary Gay Scanlon, and also Congressman Dwight Evans supported me greatly because they were able to see the work that I was doing. And so when the COVID recovery funds came through, we were eligible for that as a nonprofit. And that's where you have to have the finger on the pulse. To Dr. Oxman's point, you may not be able to get everything passed because someone owes someone else a favor and it's hard to, form coalitions and get people on the same page. But while you're fighting in DC, you can also be building up your communities at home. And that's where you got to know what's happening in your communities. And I think it started off with the do nothing Democrats. I voted as a Democrat my entire life, but I have to tell you, when COVID hit in my hometown, I left the four walls of the hospital because I wanted to prevent people from getting to the hospital. And after I called all my friends and realized they were turning people away, I knew I had to go to the people because I just said enough is enough. And I was speaking to a pastor, and I think this is the end of my time, who said to me, in the 21st century, the fact that you had to have an organization called the Black Doctors Consortium because Black and Brown people were dying at 3 times the rate in a city that's predominantly Black says to you what is happening with our healthcare system, right? And so I just point out when folks say, what will you do when times are tough? There's about 100,000 people in the city of Philadelphia that can say, you stepped up, we appreciate, and we trust that you'll do that in DC.
Thank you. So we have a bunch of questions on funding for the Israel-Palestine conflict. What will you do about it? What do you think about it? There were quite a number of questions about that. So Dr. Stanford,
Okay.
it's your turn.
Okay. So you asked twofold. You asked about
Mhm.
funding and you asked what I think about it.
Mhm.
So, okay. So and when you say about funding, do you mean funding that I will accept or funding from the United States to
What do
support
you think
Israel?
the United States should do about funding Israel?
Okay. What I think is that the relationship between Israel and the United States is one that precedes and predates all of us. Largely, the reason why was to protect Israel, especially from terrorist groups, and also to protect the United States, meaning having international relationships and having strong relationships. We know that that has gone awry with dictators who are leaders like Netanyahu and like 47. And so I believe that you can't just sign something that says all the weapons go to Israel whenever they need them without accountability. I do not believe in politicizing food and aid that is necessary for Palestinians. I do not believe that one life is more important than another. And for me, when legislation comes across my desk for funding, each time I am going to look at each bill carefully. One of my good friends who is married, his wife is a rabbi, talked to me about their daughter who lives in Israel and how they fear for her safety. And that's looking at it for me from a different perspective. I also have friends who are concerned because there are children who are suffering, who are victims of violence. And so for me, as a surgeon who has operated on people who have been victims of gun violence, and I see what that does to a body, it's not going to be a blanket, I support all weapons all day, all the time. I'm going to look at each individual case differently as I make a decision and as I vote. And that's the best way I can describe it, is that one human life is not more important than another. And I will not blanketly say that I will always vote one way or the other. But I do understand the importance of the relationship between Israel and the United States, and that each Palestinian and each Israeli have the right to have freedom and dignity and safety. And that is what I'll support. I appreciate that 30 seconds.
Okay, Dr. Oxman.
So let me answer the question directly at the top, and then I want to go into a bigger perspective on this issue. So my answer to that is any country that accepts weapons from the United States needs to abide by the laws that govern the use of those weapons. So if those weapons are used, are credibly associated with human rights violations, that's a violation of the law. And it doesn't matter whether that country is an ally or not. It's, we have one rule for every country. And I say this as a Jew and as a supporter of Israel, right? Look, the the conflict is complex, right? But we can never let the complexity of the conflict stop us from saying things that are very simple. Okay? October 7th was the largest massacre of Jews since the Holocaust. Similarly, very simple, very similarly, the indiscriminate killing of civilians in Gaza, the use of weapons of food as a weapon of war, that's also a war crime. And while we can have all sorts of discussions about the history of the conflict, 1948 versus, the occupation of the West Bank, all those things are relevant. We can never use that complexity as an excuse for saying things that are very simple. The My son was studying in Jerusalem on October 7th. I'm a supporter of Israel. I'm a very harsh critic of the Netanyahu government. I think the Netanyahu's government's actions not only are horrific in terms of what it's doing to Gaza and Palestinians, but it's driving Israel into a ditch from which I don't know if it will ever be able to pull itself out of. The vast majority of that people in that land want peace, and the fates of those two peoples are inextricably linked together. There cannot be Israeli security without Palestinian self-determination and vice versa. And I think what the United States needs to do is to lead with values and consistent. That doesn't mean I don't see a conflict between being pro-Israeli and pro-Palestinian, because ultimately peace relies on promoting both of those people. And I think for too long, particularly amongst Jewish circles, I can tell you personally, any criticism of the Israeli government was equated with being anti-Israeli, which is ridiculous. And I think, the United States, we need to elect leaders who have the courage of their convictions to speak the truth on this issue. And as someone who's this issue is so important to me personally, I will always do that.
Thank you. I think we are at the point now where we are ready for your closing statements. And I believe that Dr. Stanford went second. So how about if you go first for your closing statement, please? Dr. Stanford.
Sure. Oh, I one second. I was looking at questions in the chat. Did we get all of those? Okay.
No, we didn't. We didn't have time for them
We don't
all.
have time.
We had a lot of questions that were submitted when people signed up. And so the
Hmm.
questions that I asked were from those questions.
Okay. All right.
You can use
Three,
some of your time if you like to answer the questions. It's up to you.
3 minutes or 2 minutes?
Three.
Three. Okay, so there was a question in there about taking PAC money, and someone asked a question to me about this before, and I didn't have a chance to answer it. So I'll use this because I know all you guys talk to each other. So I can tell you that I have not taken PAC money. There was one medical PAC organization that donated to me in this last quarter. I found out that they had some issues with Medicaid and Medicare fraud of all things. And as soon as I learned about it, I sent the check back. And so I just want that to be on the record in case anyone asks, because there was one donation from me. Other candidates said, oh, yeah, I took a little PAC money. But I'm letting you know for the one PAC that did send me money, I have since returned that check. And that is what I believe for any money I receive, that I must believe in the policy of the organization and the individuals, or I will not accept, nor will I allow it to sway how I vote and my integrity. Okay, now uh, for the end. Thank you for giving me the time tonight. As you're looking at candidates, I want to share with you non-medical things about me because you all know what I did during COVID. I am a grassroots organizer, but I am also someone, the only one with federal leadership experience. So I basically went from Section 8 housing to grassroots organizing to the White House when I was appointed by President Biden. And when I oversaw in Health and Human Services, I was part of the 988 legislation for the crisis hotline. I was part of the postpartum care to extend for mothers up to a year at the state that came from the federal level to the state government. And I was a part of lowering prescription drug costs and also hearing aids. That was all policy that I supported, that I was part of the legislation and disseminating it to the 5 states and the District of Columbia I was responsible. Also, I'm the only one who has had a business with 50 plus employees that I have to make payroll every 2 weeks so that they can support their families. That is a skill set that is important. And so, in the final part, I'll just say is that my love and loyalty for the city of Philadelphia can never be questioned. In a time when other people were running away from the fire, I ran to it to save lives. And as as a public servant, my default is to serve, and I'm ready to do it at the next level. People know my name from service, and I want to use that influence to continue to represent Philadelphia at the next level. Thank you.
Thank you, Dr. Stanford. Dr. Oxman, it's your turn.
Well, before I get into a little bit of a closing statement, I just want to say about my philosophy of PAC money is I've never taken a dime. I never will take a dime. And the reason is because I've seen the corrupting influence of it. I like to tell the story often about pharmaceutical reps coming into the hospital and plying doctors with gifts and promises of steak dinners. And my colleagues who say to me, Dave, don't worry. We're not going to be influenced by the gift. We're just going to have a steak dinner. And I say to them, do you think it's charity? Do you think they're taking you to the restaurant because they like hanging out with you? No, they're taking you to the restaurant because they know it works. They have the data to even show that it works. And I don't understand why you wouldn't want a physician that was bought and paid for. Why would you accept a politician? So that's my stand on corporate PAC money. I want to talk about one thing I didn't get to mention. I mentioned it a little bit in my bio, but I didn't get a chance to talk about it. Is one of the things I do besides my writing and my advocacy and taking care of patients is I teach ethics to medical students. Why am I bringing that up now? I'll tell you why. Because ethics is about how we live out our commitments to each other. And it's been said that politics is nothing more than ethics done in public, meaning that every policy, every law, every budget, these are not just political statements. They're not just ledgers and on a financial page. They are moral documents. They express who we care about, who we don't, who we choose to uplift, and who we choose to leave behind. And I do not have a legislative record to bring to this race. I mean, I think there are many people who have shown that you don't need a legislative record to come in and be a very effective leader in Congress. But leaving that aside, what I can tell you that I offer is an absolute moral clarity about what is at stake in politics. And if I should have the honor of representing this district in Congress, I can promise you that every single day I will bring that clarity to every single thing that I do. Thank you.
Thank you very much, Dr. Oxman. So let me turn it over to Vicky
All
to,
right.
to have some closing remarks.
Great. All right. Thank you, everyone, for coming. It's great to have you all here. It was great to have these two illustrious candidates this evening, Dr. Oxman and Dr. Stanford. It's wonderful to have you both. Really, really interesting. Also, we will have another candidate forum next Thursday with the 3 elected officials. So be sure that you've signed up for that. And also, don't forget, March 28th, No Kings. It's coming again. So look for it in the newsletter. The sign up came out today from Indivisible National with the map and everything. So we already have over 300 people signed up for it, but in like the last hour. So it'll be in the newsletter next time now that we have a link to sign up and all the information and all the details about it. But we hope to see you there. It should be great. We're going to have a lot of music. All right.
Wonderful.
Thank you all. Thank you
Well,
all.
thank
you,
you for
everybody.
having me.
Great. Oh, of course.
Thank you.
Thank you so much. This was terrific. Thank you.
Good night, Dr. Stanford. Talk to you later.
Bye-bye.
Bye-bye.
Bye, everybody.